So the Australian Centre for Integration of Oral Health is really leading the way both nationally and internationally in trying to integrate oral health into primary healthcare. So in last year, the World Health Organization invited us to conduct a workshop at their first ever global oral health meet in Thailand with a few of colleagues from other institutions and countries. And I guess what was clear there was that there's a lot that still needs to be done in the integration of oral health into primary healthcare, particularly from various developing countries. So it's really important to really start collaborating with various countries internationally to share that knowledge, because there is a lot of duplication happening in this space. So we've been actively working with various governments and institutions in different countries to try and share what we've done, but also learn from them what they've done so that we can really enhance that integration of oral health into primary health care.
The collaboration between University of Ulum Dubai and ACIOH started around 3 to 4 years ago. The first project we have worked on, it's about developing the oral health training for oncology healthcare providers, and which is really important in Dubai and in United Arab Emirates, where this kind of programs doesn't exist at the moment. The other program we have worked on, it's actually a research project where we have collected different data from healthcare providers on how much important to integrate and to develop resources for cancer survivor patients, and as well as for the healthcare providers to improve the quality of care we are providing for our cancer survivors. We have learned a lot from their experience in developing the oral health programs, what they have done before in Australia, and learning from that experience in developing our oral health programs in the United Arab Emirates context.
In this collaboration, the aim to benefit of AIMS Bhubaneswar is that one is focusing in the research, the bilateral research program, and then also training in patient care and skill and medical education is one of the important component of our medical institutions that we have been giving the degree for the undergraduate medical, postgraduate medical, and the nursing, and also paramedics in various subjects. So that way is going to help I think bilateral exchange program in medical education, and also exchange program that students and the faculty members would get an opportunity between the two institutions to explore many things as regional challenges and public health challenges in different countries. I think this is a very important outcome to expand this knowledge, to spread this kind of research aims and objectives. So we are expecting that other institutions to collaborate in this same project. Maybe we can go for the multi-centric project, and your institution can lead into this to establish this research collaboration across India and across other aims.
We developed the brochures with key messages on the oral health in pregnancy. There is a clear message in English language. We translated it into Swahili language, and it has anyone who is not aware of the oral health in pregnancy, how the nutrition for pregnant person, how the pregnant mother is supposed to take care of their oral hygiene. And then after that, we looked for the partner who we can collaborate with the Ministry of Health in designing and extending some teaching materials. And up to now, we have scaling up. We scale up to 12 regions in the country. Tanzania have 26 regions, but we managed to scale up to 12 regions. That a quite number of nurses have been taught about this oral health in pregnancy. They are now capable of giving the oral health education to pregnant mother.
A
colleague of mine initiated a project in Tanzania focused on maternal and child oral health. While researching similar projects and studies on the topic, he came across with the work of ACIOH and Western Sydney University and extensive work in maternal and child health in low-resource settings. We were both impressed by the volume and the quality of the publications. My colleague contacted ACIOH and we had a Zoom meeting, and then it started about 6 years ago. Currently we are collaborating in a Finnish project. Our goal is to make the oral health valued and integrated part of nurses' education and daily work in elderly care. Western Sydney University has worked for a long time on integrating oral health into broader healthcare and training nurses in this area. Their extensive experience helps us understand what works and what doesn't, which in turn allows us to design feasible, high-quality programs, avoid common mistakes and save time. One of the most valuable aspects is that they have published a large amount of high-quality research on their work, making it easy to follow and providing strong evidence of its effectiveness.